Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You will hear part of a consultation between a psychologist and a patient called Mr. Danny. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi there, Mr. Danny. Your GP has referred you to me to discuss your recent diagnosis of tuberculosis TB. How have you been feeling about everything?
Well, it's been a lot to process, to be honest. I'm still trying to understand how I got it and how long it will take to recover. On top of that, the medication has been making me feel off, like just really tired and nauseous at times.
That's completely understandable, Mr. Danny. TB treatment can feel overwhelming, especially at first. Let's go back a bit. When did you start your treatment?
I started about 2 weeks ago. The doctor put me on a combination of medications, rifampicin, isoniazid, ethambutol, and pyrazinamide.
That's the standard first-line treatment. Are you taking all 4 medications daily?
Yes, I am. The doctor explained that it's important to stick to it, but I have to admit, I've been struggling. The side effects are tough, especially the nausea and the weird orange color in my urine.
Yes, that's a common side effect of rifampicin, and it can be alarming if you're not prepared for it. The nausea. Are you noticing if it's worse at certain times of the day or with certain foods?
Definitely in the mornings and sometimes after I eat something heavy.
Okay. Sometimes taking the medication with a light meal or switching the timing can help. We can discuss that with your doctor. Have you noticed any other side effects, like vision changes or numbness in your hands or feet?
No, nothing like that so far.
That's good to hear. Now, aside from the physical symptoms, how are you coping mentally and emotionally?
I'm finding it hard, to be honest. Knowing that TB is contagious has made me isolate myself from my family. I don't want to risk passing it on, especially to my kids. It's lonely, and I feel like I'm missing out on so much.
I can imagine that must be very difficult. It's worth noting that after a few weeks on treatment, the risk of transmitting TB significantly decreases, provided you're taking your medications correctly. Have your doctors shared any updates about that?
Yes, they said something like that, but I still feel guilty and anxious about being around others.
Those feelings are very natural, but as you adhere to the treatment, you'll regain confidence in interacting with others safely. In the meantime, are you finding ways to stay connected, even if remotely?
A bit. I've been video calling my kids and reading with them at bedtime. It's not the same, but it helps.
That's wonderful, Mr. Danny. Maintaining those connections is so important. Have you been able to rest and take care of yourself?
I'm trying. The fatigue is tough though. Even small tasks like making lunch feel exhausting some days.
Fatigue is a common symptom of both TB and its treatment. It's okay to pace yourself and prioritize rest. It might help to break tasks into smaller, manageable steps.
That's a good idea. I tend to push myself too hard sometimes.
It's a balance, isn't it? On that note, have you been able to go outside for fresh air or short walks?
Not yet. I feel like I don't have the energy, and I'm also worried about running into someone I know.
Understandable, but even a few minutes of fresh air in a quiet spot can boost your mood and energy levels. When you're ready, that might be something to try.
I'll think about it.
Good. And remember, you don't have to do this alone. Support is available. Have you looked into any local or online TB support groups?
Not yet. I wasn't sure if that would help.
Many people find it comforting to connect with others who understand what they're going through. It's something to consider.
I will. Thanks for mentioning it.
Of course. It sounds like you're doing your best to stay strong, Mr. Danny, and that's commendable. Let's keep monitoring how you're feeling, both physically and emotionally, and we'll work through this together.
Thank you. I appreciate it.
You're welcome. Remember, recovery from TB is a journey, and every step you take is progress. Let's schedule a follow-up soon to check in.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Miss Turner. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Ms. Turner. I'm Dr. Ellis, one of the physicians here at the clinic. I've reviewed your chart and I'd like to discuss your symptoms with you. What brings you in today?
Hi, Dr. Ellis. I've been feeling really unwell for the past few days. I started with back pain, but now it feels worse, and I've got a fever too.
I'm sorry to hear that. Let's go through this step by step. When did the back pain first start?
It started around 3 days ago, but I didn't think much of it at first. I thought maybe I had just pulled a muscle.
I see. And is the pain localized to one side, or do you feel it across your entire back?
It's mostly on the right side, just below my ribs. It's a dull ache, but sometimes it gets sharper.
Understood. Have you noticed any other symptoms, like pain or discomfort while urinating?
Yes, actually. It started yesterday. It burns when I go, and I feel like I need to pee all the time, but not much comes out.
That sounds uncomfortable. Have you had any changes in the color or smell of your urine?
Yes, it's darker than usual, and I noticed a strong smell.
All right. Have you been experiencing nausea or vomiting?
Yes, a little. I felt nauseous this morning, but I haven't actually thrown up.
Got it. And you mentioned a fever earlier. Do you know how high it's been?
I took my temperature yesterday, and it was 38.5 degrees Celsius. I've also been having chills and sweating a lot.
Thank you for sharing that. Fever, back pain, and urinary symptoms suggest a possible kidney infection, which we call pyelonephritis. Have you had any similar episodes in the past?
No, this is the first time.
All right. Do you have any history of urinary tract infections?
Yes, I've had a few in the past year, but they were mild, and I just drank more water and cranberry juice.
Did you seek medical treatment for those infections, or were they self-managed?
No, I didn't go to the doctor. They cleared up after a few days.
Thanks for clarifying. It's important to know that untreated or recurrent urinary tract infections can sometimes lead to kidney infections, so it's good you came in today. Let's discuss your medical history briefly. Do you have any chronic conditions like diabetes or kidney disease?
No, nothing like that.
And are you currently taking any medications, including over-the-counter drugs or supplements?
Just a multivitamin every morning.
Any allergies to medications?
I'm allergic to penicillin.
Good to know. Have you noticed any unusual fatigue or weakness?
Yes, I've been really tired, and it's hard to get through the day.
That's quite common with infections like this. Now, I'll perform a physical exam to check for any tenderness or other signs around your kidneys. Before we proceed, I'd like to ask, are you drinking enough fluids?
I think so, but maybe not as much as I should.
Hydration is important, especially when dealing with urinary tract or kidney issues. We'll also need to run a few tests to confirm the diagnosis. I'll order a urine sample to check for infection, and we may do a blood test to assess kidney function and infection severity.
Okay. Will I need any imaging?
Possibly. If needed, we might do an ultrasound or a CT scan to rule out kidney stones or other complications. But we'll start with the urine and blood tests first.
All right. What kind of treatment will I need?
Treatment typically involves antibiotics, but since you're allergic to penicillin, we'll select an alternative medication. It's essential to complete the entire course of antibiotics to ensure the infection is fully cleared.
How long will it take to feel better?
Most people start feeling better within 48 to 72 hours after starting antibiotics, but the full recovery may take a week or so. Rest and staying hydrated will help speed up the process.
Okay. Is there anything I should watch out for?
Yes, if your symptoms worsen or you experience new symptoms like severe abdominal pain, persistent vomiting, or confusion, you should seek medical attention immediately. Also, if your fever doesn't improve within a couple of days on antibiotics, let us know.
Got it. Thank you, Dr. Ellis.
You're welcome. We'll get started on those tests right away, and I'll check back with you once we have the results. Take care, Ms. Turner.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear an instructor's objective on a refresher program. Now read the question.
Welcome to today's program. The objective is to provide a practical and comprehensive refresher for practicing optometrists, managing dry eye disease and related conditions. This course is particularly tailored to those focusing on primary eye care settings and aims to enhance understanding of the complexities of diagnosing and managing dry eye conditions. The program does not cater to those pursuing subspecialties or research in dry eye disease, as it is centered on common clinical practices. Sessions include workshops on innovative treatments such as intense pulsed light, IPL therapy, and lipid-based therapies, along with tools for patient education and compliance strategies. The program concludes with a roundtable discussion on challenges and opportunities in managing dry eye in routine practice.
Now look at question 26. You hear 2 colleagues talking about lab results. Now read the question.
Let's go through it. Elevated cardiac enzymes like troponins are key markers of myocardial damage. So, what's the normal reference range for troponins?
Oh, for most labs, it's less than 0.04 nanograms per milliliter.
Exactly. And what's the next step if the levels are elevated but not diagnostic of myocardial infarction?
You'd assess for trends by ordering repeat tests over time.
Correct. Now, do you see a pattern in these results that suggests myocardial infarction?
Well, the levels seem to be increasing significantly over time.
Now look at question 27. You hear a nurse educator and a nursing trainee discussing post-operative care for joint replacement patients. Now read the question. Now, let's talk about the key points in post-operative care for a patient who has undergone a total knee replacement. What would you consider essential in your patient education?
First, I need to make sure that the patient understands the importance of pain management. I'll explain how to take pain medication as prescribed and discuss non-pharmacological methods for pain relief. I'll also emphasize the significance of early mobilization to prevent complications such as blood clots.
Good. And what would you mention regarding the use of mobility aids?
I would explain how to properly use a walker or crutches and stress that they should avoid putting too much weight on the operated leg until cleared by the surgeon. Is there anything specific I should remind them about at this stage?
Yes. You should remind the patient that they may experience some swelling and warmth around the joint as part of the healing process. What's the final step in ensuring that they are well informed?
Before discharge, I'll make sure they know how to recognize signs of potential complications, like increased redness or fever, and instruct them to contact their healthcare provider if these occur.
Now look at question 28. You hear two hospital coordinators talking about a recent event aimed at recognizing and retaining volunteers. Now read the question.
So, what did you think about the volunteer appreciation luncheon?
Well, considering the number of volunteers who could make it, I'd say it was quite a decent turnout. It's always a challenge to coordinate an event around their schedules since many are already committed to their volunteering hours and personal lives. I was glad to see so many manage to come.
Yes, definitely. And the feedback form seemed pretty positive, which is a good sign. But from my perspective, I couldn't help but wonder if we put enough emphasis on recognizing individual contributions. Making sure each volunteer feels uniquely valued.
Yeah, that's a valid point. We could look into adding more personalized touches for the next event to make it more impactful.
I think we should.
Absolutely.
Now look at question 29. You hear two colleagues talking about a challenging patient. Now read the question.
Jamie, I have a patient case that's been quite challenging, and I could use your advice.
Of course. Happy to help. Are you referring to Alex, the young person you mentioned last week?
Yes, that's them. Alex identifies as non-binary and recently started therapy to address anxiety and depression. They shared that a lot of their distress stems from feeling pressured to conform to societal gender expectations. Their family is struggling to understand their identity, and Alex feels unsupported at home and in their social circles. On top of that, they've faced difficulties accessing gender-affirming healthcare, which only adds to their stress.
That sounds tough. It's clear Alex needs a support system that understands their experiences. I'd recommend referring them to a specialist who works with transgender and non-binary individuals. A counselor or support group experienced in gender identity issues could help Alex process these challenges. It might also be beneficial to connect their family with resources to better understand and support Alex's identity.
Now look at question 30. You hear a discussion on safeguarding patient privacy. Now read the question.
I'll be discussing an essential aspect of our profession, safeguarding patient privacy and ensuring compliance with confidentiality laws. In the past, we often discussed patient cases openly in shared areas like hallways or cafeterias, where information could inadvertently be overheard by unauthorized individuals. While this practice may have seemed convenient at the time, it has led to several breaches of confidentiality and complaints from patients, their families, and even regulatory authorities.
Patients have a right to trust that their personal information is secure and used appropriately. A lack of trust erodes the therapeutic relationship, leading to dissatisfaction and reduced care quality. For these reasons, we are adopting a new protocol requiring all discussions about patient cases to occur only in designated private areas. This protocol also includes limiting access to patient records to authorized personnel and ensuring digital records are secured with updated encryption. By implementing these changes, we aim to rebuild patient trust and comply with the legal and ethical standards of our profession. That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear Dr. Heather Miller giving a detailed presentation on the care of individuals with advanced dementia in a home setting. You now have 90 seconds to read questions.
My name's Dr. Heather Miller, and I specialize in geriatric medicine with a focus on dementia care. Today, I'm discussing a critical topic, the care of individuals with advanced dementia in a home setting. This aspect of care requires unique strategies to manage challenges like behavioral symptoms, safety concerns, and the emotional toll on caregivers. Providing care at home can be beneficial for individuals with dementia, offering familiarity and comfort. However, it also demands significant resources and support systems. Behavioral symptoms, such as aggression, agitation, and wandering, are common in advanced dementia and can be particularly challenging to manage in a home environment. These behaviors often stem from unmet needs, discomfort, or confusion, and addressing them requires a multi-pronged approach, including caregiver training and appropriate interventions. Safety is another key concern. As dementia progresses, individuals may lose awareness of dangers, increasing the risk of accidents or injuries at home. Modifying the living environment to reduce risks is essential, but so too is caregiver vigilance. There's also the emotional aspect. Caring for a loved one with dementia can be rewarding but emotionally exhausting. Caregivers often experience burnout, feelings of isolation, and anxiety. Without adequate respite care or emotional support, these challenges can become overwhelming. Recent initiatives have focused on effective home-based interventions and improving support systems. For example, many caregivers report that tailored training programs improve their ability to manage behavioral symptoms and make them feel more confident in their role. Similarly, the use of respite services, temporary care provided by professionals, allows caregivers to take much-needed breaks. The Dementia Support Network recently conducted a nationwide survey to assess caregivers' experiences and the support available to them. Over 800 caregivers responded, providing invaluable insights. One striking finding was that many caregivers didn't feel prepared for the behavioral symptoms of advanced dementia. 63% reported that they had received no formal training, yet almost all said that such training would have improved their caregiving experience. Another critical finding was about safety modifications. Although most caregivers acknowledged the importance of home modifications, nearly half said they didn't have access to professional advice on creating a safer living environment. Moreover, only 42% had implemented significant safety changes, highlighting a gap between knowledge and action. The survey also revealed mixed feedback about respite services. While 70% of caregivers expressed interest in using respite services, only 30% had actually accessed them. Many cited logistical barriers, like transportation or lack of availability, as reasons. Nonetheless, those who did use respite care reported feeling more refreshed and better equipped to continue their caregiving responsibilities. On a positive note, there were examples of home-based care working exceptionally well. For instance, some caregivers spoke about the benefits of consistent routines and activities tailored to their loved ones' abilities, which reduced agitation and improved their overall quality of life. To conclude, managing advanced dementia at home is undeniably complex, but with the right support, it can be a fulfilling experience for both caregivers and individuals with dementia. Policymakers and healthcare providers must prioritize caregiver education, accessible respite services, and professional advice on home modifications to empower caregivers and improve the quality of care.
Extract 2. Questions 37 to 42. You hear Dr. Marcus Bell discussing about a research. Now, read the questions. You now have 90 seconds to read questions.
Good morning, everyone. My name is Dr. Marcus Bell, and today I'd like to discuss research I've been working on concerning a topic that affects oncologists and other healthcare providers: patient-centered communication in oncology care. Now, let me start by saying that patient feedback generally reflects a positive attitude toward the communication they experience in oncology departments. However, I became particularly interested in this area during a conversation with a patient who expressed confusion over her treatment options. She felt overwhelmed despite the efforts of her care team to explain everything thoroughly. That made me realize how crucial it is to ensure every patient not only hears, but truly understands what is being conveyed to them. Let's take a look at the typical communication touchpoints in oncology care. From the initial diagnosis to discussing treatment options and prognosis, there are numerous interactions where sensitive and complex information must be conveyed. For patients, processing these conversations is often difficult, especially as they face emotional stress and physical exhaustion. For example, during consultations, Doctors might explain potential side effects of a chemotherapy regimen, but a patient in shock may only retain fragments of the discussion. It is vital to check comprehension at every step, using language that is clear and accessible. To illustrate this, let me share a case that highlights potential miscommunication. A middle-aged patient diagnosed with stage 3 lung cancer was given a choice between 2 treatment paths: an aggressive chemotherapy regimen or a clinical trial involving immunotherapy. The oncologist believed the patient fully understood the risks and benefits of both options, but it later became clear that the patient had confused the side effects of one treatment with the other. This led to emotional distress when the chosen treatment resulted in side effects she hadn't anticipated. While this case was resolved, it illustrates how easy it is for misunderstandings to arise in such critical situations. To better understand how cancer patients perceive communication in their care, my team conducted a survey across several oncology clinics. The survey aimed to evaluate communication effectiveness, focusing on whether patients felt informed, respected, and supported. It included questions about their expectations versus their experiences, as well as their emotional responses to conversations with healthcare providers. Participants also rated how likely they were to recommend their clinic to others based on the communication they experienced. The results were enlightening. Patients often praised oncologists for their empathy and ability to explain medical concepts clearly. However, one recurring issue was the volume of information delivered in a short time, which left many patients feeling overwhelmed. Additionally, while staff members generally avoided medical jargon, some patients still reported confusion over specific terms or concepts, particularly when discussing treatment risks. Another notable finding was the importance of addressing patients' emotional well-being during consultations. Patients who felt their oncologist acknowledged and validated their fears reported higher satisfaction with their care. Conversely, those who perceived interactions as rushed or impersonal were more likely to express dissatisfaction. A particularly intriguing discovery emerged when analyzing responses about follow-up communication. Patients who received written summaries of their consultations or treatment plans reported feeling more confident in managing their care. This reinforces the idea that providing multiple modes of communication can enhance patient understanding and engagement. In conclusion, our findings highlight the need for a more patient-centered approach to communication in oncology. By focusing on clarity, empathy, and emotional support, we can help patients navigate their cancer journey more effectively. Further research will explore how specific interventions, such as the use of visual aids and follow-up discussions, can improve outcomes for patients and their families.
That is the end of Part C. You now have 2 minutes to check your answers.